This is a 35-year-old gentleman who had undergone a previous carpal tunnel release that had been complicated by infection. Though the infection was subsequently cleared, the patient developed recurrent pain and carpal tunnel symptoms. In particular, the patient had sharp electric pains that shot into his fingers as he ranged his wrist and finger simultaneously, which is indicative of traction neuritis. The decision was made to proceed with revision carpal tunnel release, median nerve neurolysis, and autologous vein wrapping. You can see a standard, though extended, carpal tunnel release is incorporated. The dissection is extended beyond the proximal and distal aspects of the previous dissections. Here the median nerve has been identified and confirmed with electrical stimulation. Now working from both proximal to distal as well as distal to proximal, the median nerve is dissected from the surrounding tissue. You'll see that some of the adhesions can be swept away. Some of the adhesions are easily isolated and defined but require sharp excision. And some of the adhesions are so dense and obscure that the plane between the adhesions and the median nerve has to be sharply established. The nerve is dissected circumferentially You can see that we're taking care to remove all the adhesions, but also to not damage the median nerve. Though some traction on the nerve can help identify the adhesions, spreading aggressively into the median nerve can cause damage to the nerve. Once the nerve has been completely freed up from all surrounding adhesions, the length of the nerve that needs to be wrapped is measured. We know that we'll need 4 times as much vein as area to be wrapped. The saphenous vein is harvested in a standard fashion. We identify the vein distally, anterior to the miomalleolus, and trace it out proximally. Once we have the required length, the vein is split longitudinally. Though obviously branches of the vein need to be ligated or cauterized within the leg, the branches attached to the vein itself can be left alone. The vein is then taken to the median nerve and wrapped around it in a spiral fashion. Though it's not demonstrated in the video, the distal aspect of the vein graft is sutured to the tissue bed around the median nerve. We then continue to wrap the vein around the median nerve in a spiral-like fashion, and the proximal end of the vein graft is also secured to the soft tissue bed around the nerve. We then place 6/0 monofilament sutures between the loops to secure the vein wrap construct. The goal is to have the vein secured to the tissue bed, but to allow the median nerve to slide within the vein graft. Hemostasis is obtained, and the skin closed in standard fashion.